Welcome to day one of ISHLT. I'm joined here by Dr. Errol Bush from Johns Hopkins. And Dr. Bush did an excellent presentation earlier today on the Beauregard outcomes. Dr. Bush, do you want to share with us some highlights from that presentation?
Well, thank you for the opportunity. As we're getting more and more aggressive at finding donor lungs for our recipient, we're traveling further and further to get those organs, which means that they're not receiving blood flow for a much longer time. And we do know that being out of the body that long can lead to the organs not working very well. And now we have technology that can actually help to decrease the risk of those organs not working very well. So the Beauregard actually provides not only temperature regulation, but pressure regulation. And what we were able to find or show in our analysis was that by using that device and controlling temperature and pressure, that many outcomes were actually were improved, especially people that might have longer hospital stays or be in the ICU longer. That with that technology, they would actually recover better. And it's thought that even the patients that use this device or receive lungs that are on this device, that many of those patients have fewer complications, and that can actually translate again to shorter hospital stay, but also more importantly, less cost for the patient and the health system.
Excellent. Well, thank you, Dr. Bush. We always appreciate your partnership. And also, I'd like to let everyone know that tomorrow, Monday at noon, there will be a symposium where you will also be presenting Beauregard as well as some additional data for us. So join us all tomorrow, 11:45 in the symposium sponsored by Paragonix. So thank you.
Look forward to it and lots of pretty pictures tomorrow.
Excellent. Bye.
So we're in the poster session on the first day of ISHLT. It's really busy. I'm here with Maya from Massachusetts General Hospital. She's presenting some very exciting research. Maya, do you want to briefly just talk about what the goal of this research is?
We're looking at various times of controlled static cold storage. We did a minimal time, which is 0 CIT. We did a 5-hour cold ischemia time group, as well as a 7-hour cold ischemia time group, all in the Paragonix Sherpa pack. Then we used NMP system for evaluation of these graphs. We do 1 hour of Langendorf followed by 3 hours of loaded mode. Here we have a bunch of different results. We have various biochemical results across the duration of the perfusion. For example, we have lactate measurements, which can be seen to be increasing across all groups. We also have more functional data. These are taken using a left ventricular pressure monitor. They basically can show us things like contractility, which again is a measure of function for the heart. Another option and really exciting part of the work we're doing is we were looking at the mitochondrial state of these graphs. So we are interested in comparing post-storage, which also known as pre-perfusion, and post-perfusion. And we saw that interestingly, the viable mitochondria did not change across any of the groups, which is really exciting. We also have another really exciting method of real-time mitochondrial health monitoring, which is called resonance Raman spectroscopy. And then we did a set of inflammatory marker panels at the end of our perfusion.
Very exciting. So what are some impacts long-term to the field of heart transplant as a result of this research?
Yeah, this is really a great question. So DCD hearts are really underutilized in the field of transplantation. So the idea that we could potentially expand the donor pool with this work would be the real lasting impact.
Fantastic. Thank you so much, Maya. Hi, everybody. We're the first day of ISHLT. We're here with
Lawrence Ceulemans. Hello, everyone. I'm a professor of transplant surgery at the University Hospitals in Leuven, and it's a pleasure to be here today with you, Pratik.
Thank you. Dr. Ceulemans just gave an exciting talk on extended criteria donors using moderate hypothermia. Dr. Ceulemans, what's really exciting for you that's coming out of this research?
So first of all, it's quite a privilege to present this data on behalf of the entire Guardian Lung Registry investigators. In total, we capture now with the registry almost more than 1,100 lungs divided between lung art and ice. And for this, we looked specifically at extended criteria donation. And we compared both in an unmatched and in a matched comparison, these lung art preserved lungs with the ice preserved lungs. And although there were not a lot of differences regarding baseline demographics for donors and recipients, there was a very important finding, and that was that rehospitalization rates of lungs preserved with lung art were significantly lower compared to ice preserved lungs for these extended criteria donors. And that's something that will require some more in-depth research in the future, I think.
Thank you. Yeah, that's really fascinating. I think the reception was really great afterwards. Any specific talks that you're looking forward to over the next few days?
No, I think ISHLT is always a gathering of everyone who is interested in the same topic. A lot of meeting friends, colleagues, finding new friends, a lot of networking, and always looking for innovative aspects. There are talks on xenotransplants, in lung transplantation, on different preservation techniques, assessments. So it's always very inspiring to be here.
Yeah. Thank you. Thank you for the KU Leuven team and Dr. Ceulemans' team for everything you do and for helping advance the field of transplantation.
Thank you.
Hello, and welcome to the end of day one at ISHLT 2025. I'm joined here today by Dr. Hannah Copeland. She is the president of the Women in Transplant and MCS, otherwise known as WITNEX. And, I'd really love to hear your take on just the growth of women representation, both on the side of research and on the side of women patients in heart failure and the research that goes on there.
Thank you so much, Mary. It's been a great few years of us developing and really starting with the initiative, Women Supporting Women in the Field, increasing the women in the field of research, increasing women representation at the podium and what women are doing. And in the society, we work to have collaborative research, publications, and promote women in the field. And now we're moving to next steps with starting to have a webinar series on education about the specifics to heart failure in women. Both in the MCS space, both in the heart transplant space and donor preservation. What can we do to identify the differences to have better outcomes for these patients? So it's about lifting as we climb and supporting the women that we need to who are patients for better outcomes for them, and identifying more patients earlier so that more women in heart failure can be identified and get the care that they need sooner.
Would you like to share with us the date so people can tune in to that first webinar?
Thank you so much. The first webinar in our series of advanced heart failure in women is Monday, May 12th at 8 p.m. And it is about durable LVAD support in advanced heart failure for female patients.
Excellent. Look forward to seeing that webinar. Thank you. And I hope you enjoy the rest of the ISHLT meeting.
Thank you so much.
Thank you.
We're the first day of ISHLT. And we're here with Dr. Trivedi and Dr. Crane from University of Louisville. We're really excited to talk about how things are going. How's the first day been for you, and what are some talks you're looking forward to?
So the first day has been fantastic, and this is my 13th year at ISHLT.
Wow.
So it's been a long time, and I'm really looking forward to some of the DCD talks. We had some good sessions, this afternoon. And I hope there are more exciting sessions to come tomorrow. And also looking for some new technology in LVAD development. So we'll see how that goes. Thank you.
Cool. Dr. Crane?
This is my first year at ISHLT, and it has been great so far. I went to a couple of LVAD talks, some EVLP talks. Very much looking forward to my own talk on VV ECMO bridging to transplantation. And then we have a few other talks from University of Louisville, one by Dr. Endo on Wednesday as well, which should be good.
What day is your talk and time?
It's Monday at 5:15.
Fantastic. We're looking forward to that. Thank you, guys.
Thank you.
Hi, this is Lisa Anderson, President for Paragonix Technologies. I'm really excited to be here with Dr. Danny Goldstein from Montefiore. We are here at ISHLT 2025. It's day one. Dr. Goldstein, how about the scientific sessions?
Well, Lisa, first of all, this is my favorite meeting. We have an opportunity to go to many scientific meetings. This is by far the best meeting dedicated to heart, lung transplant, and end-stage lung and heart disease. My favorite thing about being here is the people. It's a unique place because you get an international flavor. You get people from multiple specialties, which you've never seen any other meeting. And it's really become a family. It's really more a family meeting than an academic meeting. So I'm delighted to be here. The first day of scientific meetings was awesome. So happy to be here.
Fantastic. And tomorrow we have our symposia, our first symposia for lung preservation. And on Tuesday, we have our heart symposium, which you are a part of. So we'll be seeing more of Dr. Goldstein on Tuesday. Thank you so much.
Thank you.
Dr. Salerno, thank you so much for joining us and welcome to ISHLT 2025.
Thank you for having me.
Oh, of course. Would you mind maybe introducing yourself and letting us know maybe how you got into heart transplantation?
Yeah, so I'm Colby Salerno. I'm a heart failure and transplant fellow at Yale School of Medicine in New Haven, Connecticut. I'm in my final year of training, and I got into transplant care because I'm a heart transplant recipient myself.
Amazing.
13 years now post-transplant.
Congratulations.
Thank you.
Absolutely. No, I think it's an exceptionally exciting time to be in transplant with all the innovation. And I think to your point with CAV, it's definitely still considered the Achilles heel of heart transplantation. What do you think the future looks like in terms of interventions and management for CAV, or maybe things we can do upstream to try and prevent it as well?
Yeah, that's a great question. You're catching me at a good time because I just came to a talk about CAV.
Wonderful.
It's interesting hearing some of the brightest minds in the world all talk about how we still don't have a very good direction on this. I will plug your own company right now. I'm hearing good things about Paragonix and possibly reduction of CAV, at least compared to ICE transfer. And so I think we need to find better ways to target specific inflammatory markers in the body and see what we can do. It's going to require huge international randomized trials, which we just haven't done in this field yet. And hopefully the collaboration here is great, and hopefully we continue it into the future.
Absolutely. And I think, again, in the field, the understanding, I think, around CAV has also progressed so much, even in the 5 or 6 years that I've been over here in the United States. I think to see how our understanding's developed is going to open new doors in terms of how we think about both upstream and downstream management and intervention.
Absolutely.
Wonderful. Well, thank you so much for joining us today. Any parting words for the team here at ISHLT?
No, thanks for giving me the opportunity to speak here. Our history now goes back. I had Lisa, who is the CEO of Paragonix, on my podcast, Both Sides of the Stethoscope, here returning the favor. So good team effort. Really excited for the future of this field.
Awesome. Well, thank you so much.
Thank you.
Good morning. This is Lisa Anderson, President for Paragonix Technologies. We're here on day 2 of ISHLT 2025. I'm here with Dr. Goswami from the Mayo Clinic, Jacksonville. Dr. Goswami, what are you looking forward to today?
Yeah, so I think, yesterday we learned a lot about anticoagulation and LVAD management. I think today I'm looking forward to organ preservation technology and looking at the right heart. And then hopefully there'll be a couple more AI talks, so I can get my AI fix.
I know you love AI, so do we. And we have some exciting announcements today at our symposium at 11:45 a.m. And also we hope to see you at our educational dinner event tonight.
Awesome.
See you soon.
Hello, I'm glad to be joined here by Julien Guihaire from Marie-Laurent Hospital in France. Welcome.
Thank you.
So you just presented your poster on improved preservation with the Sherpa Pack. Tell me a little bit about your experience in France.
So we started 2 years ago using Sherpa. I mean, at that time, I was not so confident.
Yeah,
I wanted to try it.
Yes.
So we started with 5 patients, and now we use it for all.
Excellent.
Yeah, and so the data I presented today were about high-risk transplantations.
Interesting.
Especially in Western Europe, we have older donors compared to the US, and probably also sicker recipients under mechanical circulatory support and transplanted in emergency. So I showed today that using Sherpa is safer compared to conventional ice storage in this particular difficult setting of high-risk transplantation. including combined transplantation, heart liver, heart kidneys transplant, and with all donors and high-risk recipients.
Very interesting. And this is really the first publication of a French population, or first presentation of a French population.
I think so. And you're working on a publication soon?
Yeah. Excellent.
Yeah, because it's also an effort to try to get a reimbursement of this technology in France.
Absolutely, because that's, the structures everywhere in the world are different, and making sure that it works with the government payer systems is critical.
Yeah.
Absolutely. Can I ask you, has there been other research or presentations this conference that have been interesting for you?
Yes, I've been interested in optimized preservation and the CD heart transplantation as well.
Excellent.
Because I'm really involved in that field in my country, in my hospital.
Yeah. And what do you see as major trends this year and changes this year?
I think we talk lots about organ preservation and new technologies to improve the quality of the grafts. Yeah.
Absolutely.
Major change.
Major change to the field. Excellent. And just other than that, have you been enjoying ISHLT? What do you look forward in terms of coming to ISHLT?
I like to meet people, to share experiences, and to discover new approaches and technologies as well.
Excellent. Well, hopefully going back to your hospital, you'll bring back as much learning as you can and share it with the team.
Thank you. And thank you for your support for developing this technology in France.
Oh, thank you so much. We're doing everything we can to give patients every possible advantage.
Thank you.
Take care. Bye.
Day 2 at ISHLT. I'm here with Sherry Quire, who's the Director of Organ Services at Indian and Donor Network. She just gave a fantastic talk. Sherry, do you want to tell us a little bit about your talk and the impact on the field?
Yeah, so I think that honestly, a lot of organs go unallocated and unused, especially lungs. And so we piloted with Paragonix for Bearguard program in order to increase the utilization of lungs across the United States.
It's really fascinating. I think there's a lot of great discussion afterwards. Your attendance at the ISHLT is very unique from an OPO perspective. Can you share a little bit about your learnings from the kidney side, the experience of allocated kidneys that came in handy when you allocated the first lung on Bearguard?
Yeah, so I think that, OPOs are really used to recovering kidneys, putting them on a pump, and then allocating afterwards. So the concept was not anything new to us. I think it's very helpful from a perspective also of having a unit that does not have to come back to our OPO. So that's something that is very helpful courier-wise, as well as maintenance-wise on our machines and things like that. So that's really helpful.
Great. Thank you, Sherry, and thanks again, Donor, for everything you guys do to help advance the field.
Okay, thank you.
Thank you.
Hello and welcome to ISHLT Day 2, and I am honored to be here with Professor Andreas Zuckermann, a former ISHLT president. How are you enjoying the conference so far?
It's amazing. I have learned a lot. Still, I learn a lot. I meet so many friends that I haven't seen for a year from different parts of the world, but also different companies. And I'm really interested in all these new things developing around here. So it's an absolutely great conference that I enjoy very much.
That's fantastic. And you've been part of ISHLT for a while. You're the former president. How has the meeting changed over the years, and how is it different being president versus an attendee for the conference?
So the meeting really has dramatically changed. It's become so much bigger, more than 4,000 attending people here, which is
record this year, right?
A record, absolute record. Of course, Boston is a great city to have a meeting. Yeah, for you it's a home. But the meetings, the sessions are a little more tense. They're shorter, so we have to really get down to the point. There are a lot of good topics, very good sessions, very heart-touching plenary sessions, especially today.
Right.
And I think it has become better and better. We'll see how it develops further. For me now, as a retired president, it's becoming a little bit more relaxed because I do not have to run around and shaking everybody and run just from one meeting to the other. I can enjoy it a little bit, stay here and talk to you guys, but also meet some friends and listen to some of the talks. However, I still have some duties that I have to fulfill, which I happily do because my heart always beats for the society.
That's fantastic. That's fantastic. So any talks or new ideas that you think are inspiring and are going to introduce new ideas for when you get home?
Yeah, maybe one or two. If I start to discuss this with you now, you will have a 24 hour. So I'm already full of ideas, and this is after 1.5 days of this meeting. So I just can't wait to get back home and make my team crazy with all these ideas and the stuff that we have to investigate, and evaluate. Oh, thank you, but you can't off my hook now. I ask you the question. How it is to have a meeting at your own plate?
You know, it's actually fantastic because so many more of our team can come and really get an appreciation for all the science, as well as more of our development team and engineers to see some of the talks, to meet one-on-one with surgeons and physicians. It's incredibly helpful for us as we're developing the next generation of products.
Do you get a feedback from the community, from the customers, new ideas, where the road is moving?
Absolutely. We have teams in sessions listening to what's going on, where the field is moving. It's actually, I think, been moving so quickly each year that staying on top of it is really important. So ISHLT has been an incredible partner for us, an incredible opportunity to follow what's going on and get new ideas and work with that and develop new therapies for the space.
So I give you just 2 sneak previews.
Yeah. One
is the new updated PGT is already close. So just going through the last areas of acceptance by the society, then soon it will be published. So it's a review. And the other one, I hear more and more rumors about what should be the new standard of care in preserving a heart, so preserving it. So there might be some interest of the society to invest a little bit into that on a consensus document or so in the future. I know more and fall depending on the ISHLT bureaucracy and answer on that.
Well, I certainly we would be excited about those. I mean, the last procurement consensus was in 2020. It was published in 2020. The meeting, I think, was in 2019. And at the time, there was no data on controlled hypothermia or Paragonix.
Area of preservation. This is totally changed. It has changed. And we have finally to sit together and, let's say, digest everything that we learned over the last 4 or 5 years and then put out strong points where we should invest in the future, what we should examine and evaluate in the future from a scientific level and where the future will take us. So definitely exciting times for both.
Exciting times. Absolutely. Thank you so much. Catch you next time.
All right. We have Dr. Mihir John with us here today. Can you tell us what you're most excited about at ISHLT this year?
Hey everyone, yeah, it's my first ISHLT. I'm here as a medicine resident, most excited to meet future mentors, present my couple posters here, as well as a person applying into pulmonary and critical care medicine, meet a lot of cool people who are going to help me out in the future.
That sounds awesome. Would you mind telling us a little bit more about one of the posters that you're presenting?
Yeah, today I presented a poster on the use of acrelizumab as part of a multimodal immunosuppression strategy for really highly sensitized lung transplant candidates.
Well, that sounds super interesting. So what kind of patients specifically will this project potentially help in the future?
Yeah, at Northwestern over the last few years, we've seen the influx of a lot of highly sensitized patients who we have a lot of trouble finding appropriate organs for to make sure they do well after they get their transplant. This multimodal protocol with acrelizumab has helped us be able to get them their organs faster, hopefully avoiding a lot of morbidity and mortality while they're on that wait list. And we've seen that wait list time come down, which has been really exciting to see.
Very exciting. That's incredible. Thank you so much for sharing that, Dr. John, and I wish you the best of luck. And let's all have a great rest of ISHLT.
Thanks so much. Over to it.
Hello, and welcome to day 3 of ISHLT. And I'm here with Venkat Keshav Chivukula, and it is his first ISHLT. I'd love to hear your take on my favorite conference of the year. As a first timer, I've been coming for too many years to count. So what do you think?
Absolutely. I'm mostly an SIO person, and this is my first ISHLT. And I have to say, I like it here. I like the clinical impact, and which is what has always attracted me to this field. From an engineering standpoint, there needs to be more crosstalk between the two fields, and I'm very, very happy to be here.
What has been your main focus, like in your attendance, your selection of sessions? Have you been hyper-focused on a particular topic or device?
Yeah, it's been a bit of both. I'm actually torn between the MCS space and the transplant space. I've been doing stuff in the MCS space for the past few years, and I'm trying to get into the transplant space. And that brings up so many different questions. So after all of the talks, I'm left with more questions than answers.
Well, that's a good place to be as an engineer.
Exactly.
You'll be
Scientist.
Yes, you'll be busy.
Absolutely.
Well, hopefully we'll see you at all the upcoming ISHLTs as well in Toronto next year.
That would be lovely.
Excellent. Thank you.
Thank you. Hi, everybody. This is day 3 of the International Society of Heart and Lung Transplantation. I'm here with Dr. Rajat Walia, who's the medical director at the Norton Thoracic Institute at St. Joseph's Hospital in Phoenix. Dr. Walia, how's the conference been for you, and any topics you want to highlight for the folks watching?
Yeah, the conference is great. It's always refreshing to connect with colleagues, co-workers, industry partners, seeing people after a while. The science is great, but it's also the networking opportunities and connecting and sharing ideas outside of the sessions. It's really fun, and it's also fun to watch the progression of this evolution of new technologies in lung transplantation. The field is changing so rapidly, and we're having so much availability of technologies to help us procure. I think the next thing I like to see is probably for them to talk about how the challenges facing the transplant centers and how we can address that.
Yeah, Dr. Walia, your team has the world's most experience with using commercial airline flights to transport lungs across the country. Can you share a little bit about what you think the potential of this is for the community?
I think the potential is large. At Norton, we always tried to think outside the box, and we were very grateful when we had the partnership with Paragonix to bring our first lung on Beauregard on a commercial flight. That just opened a whole new avenue of thinking and bringing lungs on through commercial flight. And as we know, the charter flights, the cost is prohibitive in many circumstances, and the carbon footprint. So one of the things I talked about earlier is the challenges the CS has imposed on transplant centers, right? It's difficult on staffing, modeling, but also the expenses we have to incur. So anything we can do to mitigate our cost burden is helpful. And if it's not going to be for every circumstance and scenario, but when it works, we'll certainly embrace it.
Well, thank you so much, Dr. Walia, for everything you do to help advance the field.
All right. Thank you for having me. Thank you to Paragonix and ISHLT.
It's day 3 of ISHLT. I'm here with Sarah Casalinova. She's a research practice manager at Duke University. Sarah, what's been exciting about the show so far for you?
All of it, but I love seeing the updates on our DCD heart kilograms, because I remember 6 years ago or so, people thought this is never going to happen, and now here we're seeing updates to long-term data at follow-up, and I love to see it.
Yeah, Sarah was part of the team that did the first DCD heart case in the United States 6 years ago now, you said?
Yeah, December 1st, 2019.
Wow, fantastic. And you also have, an interesting story of what motivates you for transplant. Do you want to briefly share that?
Yeah, so my best friend growing up, my childhood friend, Allie, she has had 3 heart transplants and 2 LVADs. And so it truly inspires me to do what I do. And not only that, but seeing all of the surgeons and doctors just working towards helping people every day. It's inspiring to be in the room with all of that.
Yeah, I know a lot goes into it, so thank you for everything you do at Duke University behind the scenes. We really appreciate it. Thank you.
Lisa Anderson here, the president for Paragonix Technologies. I'm here day 3 ISHLT 2025 in Boston, and I'm joined today by Elin Frostehav, president of the acute care therapist business of Göttingen. We just had an amazing announcement during our lunchtime symposium. We have announced the Paragonix Transplant Research Institute, a pan-organ, multidisciplinary global effort to usher in the new innovation in transplantation and donation. This would not be possible without the backing of Göttingen. And so I'm going to ask you, Elin, just describe your decision-making, the processes involved, and your commitment to transplantation.
Thank you, Lisa. It's great to be here today. It's great to be able to learn more from this field, but also to be here to really support the great initiatives and the development of this segment and how we can help more patients and really do a bigger difference here. So great to be here. Great to be able to support this really cool initiative.
We're excited to share updates with you. So please follow us along, and we're excited to share new research during next year's ISHLT.
Hi, here with me I have Dr. Matthias Peltz from UT Southwestern. Welcome to ISHLT. Your program has been presenting quite a lot of data this year. Can you tell us a little bit about the research you're working on?
Well, my personal research is really about organ preservation. Principally, main focus is hearts, and we're using different preservation technologies, including temperature control, storage, and perfusion technologies. And it's exciting during the meeting that this field is really taking off, and we're acquiring so much more data about the benefits of those technologies.
Excellent. I mean, these sessions I think have been jam-packed, and it's amazing from say 5 years ago how many preservation-focused sessions there are now versus a few years ago.
Oh, absolutely. Probably for the last 50 years, we always thought cold was better.
Yeah.
And the colder, the cooler, the better. But this is really more the end of the ice age, I would say.
Absolutely. I think it's been changing quite a bit. And what sort of other research have you seen in the space that has been interesting to you with this so far this meeting?
I think I think we have more and more. We have the clinical data, but we're also seeing the biological and mechanistic data about what preservation at different temperatures, what potential benefits they have, where perfusion fits in, how perfusion may or may not move the needle a little bit more, whether that's warm or cold. I think the fact that we're now looking at the molecular mechanisms why we have these clinical differences that we're observing, I think is really exciting, because that ultimately is going to allow us to move the field forward even further.
Excellent. And can I ask you, so you have a large research program. How important is it for programs like yourselves to have venues like ISHLT for their research and for expanding, collaborating on ideas?
Well, I think it's essential. We're not an island. I think collaboration is just critical. And whether that's institutionally or whether that's across centers, across countries, I think it's a critical component to be successful, especially, I'm a surgeon, I don't have a whole lot of time to spend in the lab. And, we do have a PhD in our lab that runs most of the projects, but even with that, we can't do everything. Right. We have to have collaborators. So we find, and this is a meeting where you can exchange ideas. You see what other people are doing all across the world, not just in the United States. And, we always pick up on something new. Absolutely. We're going to take back to our labs.
I couldn't agree more. I think even for us, for our development teams, working with people like yourselves, with people from around the world, and feeding off different ideas, we all can work together and help advance the field, which I think is so important for these meetings to be all together like this.
I couldn't agree more.
Absolutely. Well, thank you so much.
Hi, everybody. We're here again on the third day of ISHLT. I'm here with Dr. Magdy Ahmed from Mayo Clinic, Florida. Dr. Ahmed, how has the conference been for you? What are some topics you found interesting?
Actually, this year the conference is really fantastic. New presentation about the recent advancement in the field. As you know, I have been talking about DCD versus DVD, hearts and lungs.
Right.
And actually this year, we have a lot of presentations, definitely advocating for new technologies and pushing the boundaries, try to develop more devices or techniques to recover more organs.
Yep.
So this year, specifically about DCD, and it was really amazing. And that includes heart and lung as well, both of them. In addition to that, we have some new presentations on other regular, it's like kind of established techniques, but they have a new presentation on them, like infrared Copeland pump.
Got it.
And again, using new devices for preservations for the organs, heart and lung.
And over the last 5 years, how has this conference changed for you?
Yeah, absolutely. As I said, the field of transplant is really evolving. And this is, I believe, very exciting because I would say every few months we have something new.
Yeah.
New technology in the market, new technology, new techniques. And I believe that from year to year, we have different something new to present, something to talk about and discuss.
Yeah. Well, thank you so much for your time, and thank you for everything you do to help advance the field.
It's my pleasure. Thanks so much.
Here we are at ISHLT Day 3, and I ran into Dr. Matt Hartwig from Duke. Matt, what's it like to be at ISHLT, all this great science?
Well, Mary, thank you so much, and it's good to see you here. And here we are in a hall filled with literally hundreds of incredible science projects, some of which, looking at organ preservation, which I have a particular interest in. And it's been an incredible 3 days so far and another one to go.
Yeah.
And it's exciting to know that we're here at the largest ISHLT ever.
I did not know that.
Nearly 4,600 registered. So all the rooms have been full, and all the conversations have been great. And so it's been an exciting 3 days so far.
Great. Well, thank you. I learned something I didn't realize, but look forward to seeing you then next year too in Toronto. So
wonderful. Thank you so much.
Thank you. Hello and welcome to Day 3 of ISHLT. I'm standing here today with Dr. Asishana Osho from MGH. Shana, we're here in Boston, in your town. How does it feel to have ISHLT in Boston?
Well, Mary, it's great to see you again.
Nice to see you.
Yes, well, welcome everybody to Boston for ISHLT. This is the best place to have the meeting in the best city in the United States. So far, there's been a lot of wonderful content, a lot of work on preservation and ex vivo perfusion. We moderated a great session today on transplant and ECMO in the lung space, and really just great content. I hope people are enjoying the meeting and have time to enjoy Boston and all the wonderful things we have to offer. We even pulled out the good weather for the meeting, so thanks for coming, and see you next time in Boston.
Okay, well, thank you, Shauna. Take care.
Hey everybody, this is Day 3 of the International Society of Heart and Lung Transplant. I'm here with Dr. Gary Schwartz from Baylor University Medical Center. Dr. Schwartz, how's the conference been for you, and any topics that you want to mention?
Yeah, it's been a great conference so far, really something different every day. Networking, hanging out with our international colleagues. I think the two most interesting topics for me are learning about commercial transportation of lungs across the U.S. I think that's really moving the field forward. And then the technical aspects of robotic lung transplantation, which is really, really on the horizon, really cutting in.
That's fascinating. And as you think about the last 5 years, how has the topics changed at this conference as well?
Well, I think donor organ preservation is probably the hottest topic. We didn't even talk about it 5 years ago. Well, now we've got booths everywhere, scientific data everywhere, and it's been a massive change in the field.
Well, it's because of investigators like you, so thank you so much, Dr. Schwartz, for everything you do to help advance the field.
Thank you.
Buongiorno a tutti, siamo qui con il dottor Amarelli, responsabile delle liste trapianti di un importante centro italiano, l'ospedale Monaldi di Napoli, uno dei più importanti del sud.
Siamo onorati di avere la sua presenza al nostro stand. Cosa pensa di questo congresso? Come sta andando?
Il congresso lo trovo molto interessante, l'ISHLT ha ampliato i suoi interessi ed è diventata molto più multidisciplinare di un tempo. Abbiamo avuto dei confronti molto importanti sulla preservazione degli organi e abbiamo molto più attenzione a quello che è un approccio paziente-centrico che guarda a tutti gli aspetti del paziente, dalla riabilitazione alla sarcopenia e a tutti quanti gli aspetti più favoribili che noi intravediamo, fino addirittura alla xenoterapia.
Molto interessante. So che ieri ha moderato un'importante sessione sulla preservazione d'organi. Cosa può dirci in proposito?
Ho avuto l'onore di moderare insieme al professor Kirkinin, che è l'autore del libro da cui ho studiato, per cui emozionante, e il confronto è stato interessantissimo perché abbiamo sentito la possibilità di attuare la gene therapy nel corso della preservazione degli organi, aggiungere sostanze in corso di preservazione degli organi per ampliare il tempo ischemico. Abbiamo sentito l'esperienza australiana dove il tempo di ischemia è stato quasi annullato nel suo peso grazie alle nuove metodiche, e quindi abbiamo sentito un sacco di aspetti interessanti, da cui l'ultimo forse che diciamo è molto importante numericamente in Italia, l'aspetto delle infezioni nei pazienti trapiantati, nei donatori di cuore, che a volte ostacolano il prelievo, mentre invece abbiamo sentito la Duke University che ci stimolava ad osare.
Bene, la ringraziamo per la sua partecipazione. Grazie, professor. Grazie.